In Uganda, many health centres are located in remote rural areas. Due to the poor health information and delivery systems, many of these facilities are unable to report on drug stockouts, epidemic outbreaks and other issues relating to the quality of health services.
The drug we have stock at this moment, we have a Cipro tablet, is out of stock. We have amoxicillin out of stock. We have Panadol out of stock. We have gentamicin out of stock. Erythromycin out of stock. Flagyl is out of stock. All is out of stock.
In the past, health centres used traditional paper and pen to alert district officials and national distributors that drugs have run out. This was time-consuming and inefficient, leading to delays and errors. As a result, significant bottlenecks were created in the drug supply chain. But the government of Uganda, in partnership with UNICEF, is tackling this issue head-on. Due to the unprecedented access to mobile phones, technology is being used to create a seamless system of health management. In partnership with DFID and WHO, mTrac is one system which utilises SMS to allow health workers to report on obstacles they face in real time. This information is automatically sent into a national database that officials can access, monitor and ultimately respond to.
mTrac was designed to strengthen the flow of existing health management information system data, while adding in components of community monitoring and accountability. MIS systems usually provide historical accounts or post-facto audits, identifying gaps and failings long after they can be addressed. Yet there is a need for tools that provide information to course-correct mid-process as challenges arise. mTrac addresses this need. The entry point for mTrac is the Ministry of Health's 033B HMIS surveillance form, which is submitted weekly by nearly 5,000 health facilities across Uganda. This form was selected due to the importance of timely follow-up and action required for indicators, and the challenges faced by health facilities sending this data on a routine basis. The HMIS form was broken down into 8 strings, each of which are reported as an individual SMS message. Each string contains 4 to 9 indicators and begins with a code word which allows the mTrac system to properly process the data. As you can see on this form, the code words are listed, such as cases, death, OPD, test, and treat, before the indicators. An example of how one of these strings would look is listed here for confirmation of malaria cases. The healthcare worker would fill in the numbers as indicated during the week and send in via SMS the string as indicated on the form. In this case, it would be the word test followed by 7 different fields. After each report is sent, users receive immediate feedback via SMS, reading back to them the data they submitted. If an error is made, such as a submission that has a different number of fields than was expected, this is also flagged in the feedback. Health facility staff use their own personal phones for reporting. Nearly every health worker in Uganda owns a basic phone capable of sending SMS messages, which they are already comfortable with using. When we reviewed options using higher-end smartphones, issues of government capacity to take on long-term maintenance and support were raised. Potentially tens of thousands of hardware devices could need to be managed and serviced, which would pose a huge burden on the Ministry of Health. Additionally, electricity is one of the biggest challenges in Uganda with using the technology. Health workers often send their phones long distances once a week for charging. With smartphones, they would now be responsible for charging a second device, which would likely consume power at 5 to 10 times the rate of the current phone. Trainings were led by the Ministry of Health. A national team was constituted and 4 regional trainings of district HMIS officers was organized. The district HMIS officers were then responsible for further cascading the trainings to their health facilities. In Uganda, most districts have between 10 to 30 health facilities they are responsible for. Trainings were conducted by the district HMIS officers on site at each health facility and lasted about 2 to 3 hours. Most districts were able to incorporate these trainings into their routine supervision activities and complete them within 1 to 2 months. Health facility staff usually send in their HMIS 033B reports via mTrac every Monday. Social rewards and competition are the only incentives for reporting, as this is an expected part of their normal job. However, reminders for timely submission and updates on reporting completeness are shared via SMS with all health workers on a regular basis. The HMIS data is captured by the central server and made available through the internet via dashboards customized for each of the 112 district health offices in Uganda. This process is instantaneous. This is the dashboard that all HMIS officers see when they log into mTrac. Clicking on the Approve tab, they're taken to a view where they see all valid reports that are available for review and approval. These reports can be edited if there's any problem, with changes captured in the audit log. Once approved, this data is then automatically forwarded to the Ministry of Health's National DHIS2 database. This integration with other eHealth tools is critical, as most countries will be deploying separate solutions for areas including surveillance and HMIS, electronic medical records, human resource management, and logistics and medicines. Yet all these systems are interconnected. Further monitoring information can be undertaken on the messages log, where error reports are flagged. HMIS officers can respond directly via the dashboard to health workers with information that can help them correct any problems they are making. Some data, automatically analyzed, is available directly on the dashboard. This data can be viewed as trends over time and can be disaggregated all the way back to the health facility. Additionally, we encourage HMIS officers to use DHIS2 or download the data into Excel from a link on the dashboard for further analysis. mTrac is also serving as a very useful communications tool. mTrac users can filter by district, role, and facility to send out SMS message to the groups to inform them about activities and provide them with refresher training materials. During the recent Ebola outbreaks in Uganda, messages were sent to thousands of health workers in affected districts, providing them information on symptoms, precautions for caring for affected people, and updates on new outbreaks. mTrac also has an SMS anonymous service delivery complaints hotline, where community members can report on any health service issue they come across. The most common areas we receive reports on are health facilities closed during working hours, health worker absenteeism, medicine stockouts, and free medicines being sold. These complaints are sent via SMS through a different shortcode to the mTrac server. Reports from the anonymous hotline are all made available on the mTrac dashboard. On the Anonymous Reports tab, a team at the Ministry reviews and categorizes all incoming messages. This includes tagging them with the name of the district, health facility, and topic. Often, this will also necessitate translation, as complaints can be received in any language. Once the messages have been tagged, they are made immediately available on the same customized district dashboard for all district health officers. District health teams usually have 2 weeks to respond to these issues, including updating the status and recording the action taken. If reports are not acted upon by the district health teams in a reasonable time, the State House's Medicine and Health Services Delivery Monitoring Unit takes the cases on and investigates. Currently, we are receiving between 200 to 400 reports per week. This community-derived data allows health officials to identify discrepancies against official HMIS data. If both HMIS and community members are in agreement on stockouts, then the government focuses on addressing the bottlenecks preventing resupply of medicines. If HMIS and the community are saying different things, then district health officials investigate the situation at the health facility to determine the actual situation. mTrac is also supported by other UNICEF initiatives including U-Report, which uses SMS and other media to raise awareness of important development issues and create dialogue between citizens and their government. U-Report currently has over 175,000 registered Ugandans participating in weekly SMS polls and directly interacting with members of parliament on issues important to them, making this the largest crowdsourced public accountability system of its kind anywhere in the world. mTrac employs a number of additional strategies to strengthen health sector accountability. Over 200 radio talk shows have been organized across the country, providing a forum for district health workers to publicly address issues that are raised in the anonymous hotline and discuss how they are responding to them. Surveillance data is also published weekly in the newspaper and accompanied with in-depth articles focusing on specific challenges being dealt with by the Ministry of Health. By the end of 2012, nearly 2,500 health facilities and 5,000 community health workers covering over half of Uganda were using mTrac. National scale-up is expected to be completed in early 2013, with every health facility in the country participating. mTrac is now helping the Ministry of Health identify supply abnormalities, such as identifying districts as well as health facilities whose ACT consumption rates are far above the number of cases treated. Through mTrac, the Ministry of Health also knows the exact number of ACTs being consumed in each district and which health facilities are experiencing stockouts. mTrac was developed largely by Ugandan software programmers under the guidance of the Government of Uganda, UNICEF, and other partners including the World Health Organization, using a free, open-source software framework called Rapid SMS. Rapid SMS has been used to develop mobile phone applications for a wide variety of uses, including tracking pregnant mothers in Rwanda, monitoring nutrition supplies in Ethiopia, and registering births in Nigeria. The selection of using a widely supported, open-source software allows us to build local capacity for support and customization, empowering both government as well as local software developer community to manage these tools.
mTrac has done a lot of good because before there was no platform where the community engages with the service provider. So it has also created more awareness of the community of their rights. It has also helped to link the community with the government service providers. It has helped to create accountability.
It is these types of monitoring innovations that are enabling Uganda to accelerate progress towards achieving the Millennium Development Goals.